Hello, my name is Karen Padilla, and I lead the Heart Valve Disease Patient Council from Global Heart Hub. Today, I am delighted to speak to Dr. Annick Clavel. Dr. Clavel is full professor of the medicine department at Laval University and head of the Canada Research Chair of Women Cardiac Valvular Health. Dr. Clavel, thank you very much for joining us today.
Thanks a lot, Karen, for having me for this.
Amazing. So let me start by asking you, what is the impact of heart valve disease for women?
So cardiovascular disease at large is the first cause of mortality in women. And valvular heart disease actually represents a large part of this cardiovascular disease. For example, aortic stenosis, which is the most frequent valvular heart disease, is the third most frequent cardiovascular disease. So this is a huge importance. And for example, mitral regurgitation is not far from that. If we look in Sweden, that they did a study and they showed that the incidence of valvular heart disease in women is 53 women for 100,000 women. So it's huge, and it's the incidence. So it's the new case every year that the new case, this is 53 over 100,000. And in Quebec, the prevalence, so the number of patients that lives with valvular heart disease, it's with aortic stenosis, it's just one of the valvular heart disease, is 0.9% in the global population, so more adults more than 20 years of age. So in women, it's 0.6% of the patient, that the people of Quebec, more than 20 years of age, have an hospitalization for valvular heart disease. So it's really huge. What we have to know is that without treatment, valvular heart disease is deadly. As soon as the symptoms occur, and if you do nothing, it won't end very, very bad. And for women, actually, this rate of mortality, this risk of mortality is higher than in men. We know also that valvular heart disease increases with age. So the older you are, the more risk you have to have valvular heart disease. But we also have, it's possible to have valvular heart disease in a younger age, especially when we talk about congenital valve disease or a rheumatic valve disease. And for women, it has a very important impact because during pregnancy, the required blood flow that we need, it would be really higher than the normal blood flow. And so if we have a valve that does not work really well, even if it's moderate, as soon as you're going to get pregnant and that your heart rate going to increase and the flow going to increase, that this valve disease could really be an issue.
Thank you very much, Dr. Clavel. That's a very, very important statistics that you're sharing with us. And my next question would be, what are the main differences then between heart valve disease in women and men? You already mentioned pregnancy, for example, which is a very important time in the women's lifetime. What else can we see or expect?
So the main difference is not a good one, is that valvular heart disease in women are often underdiagnosed, undermined, and undertreated. Okay, so that's the huge issue, I would say, with that. And so there is many difference in pathophysiology and in presentation of valve disease in women. For example, the symptoms. The symptoms are less impressive, less violent, less specific than in men. It's more insidious, and so they went often neglected, both by the patient and the physicians. There also have so different presentation, and the issue is that women have been underrepresented in research. So even now, the presentation of a given valve disease in women could be unknown, and we can just disregard it because we don't know that it could be valvular heart disease. For example, that if we take aortic stenosis, that we know now that women have less calcification than men in their valve when they are diseased. But when we look at echo, it looked not that bad, but it could be as bad as it is in the men. But we don't see them that much often, so we could say, oh, it's not that bad. So yeah, so those difference is the thing is that we don't know exactly what's happening in women.
Thank you very much, Dr. Clavel. I think that's very important as well to know. And you mentioned something that is also very relevant, which is the underrepresentation of women in research. And now, when we talk about heart valve disease per se, why does it present differently in women? Is it like an anatomical aspect, or is it a pathological aspect, or both?
Okay, so actually that's the 1 million question, you know. I would say the easy answer is that we don't know yet, and it's a little bit of everything. First, we know that for a given height, size, and body surface area, that the women are going to have smaller heart than men, even if they have the same size. So, so the measurement that we use to assess the severity could be underestimated in women, because we want something larger that they couldn't achieve because they are smaller and they have smaller heart. That's the first thing. Then the pathophysiology probably is different too, and it could be linked because of the 2 XX chromosome that we know that there is some gene in that chromosome that should be silenced because they are in both, you know, both replicate and should be silenced. And we know that we have some that escape this silencing, and it could be one reason that the pathophysiology is different. And we have the hormones. Obviously, you know, the sex hormones are different, and so they could play a role. And especially the loss of this hormone at the time of menopause in women could be also why we have a different presentation of valvular heart disease. And finally, the valve disease is so disease of the valve, but it's not only the valve that is disease, because there is an issue in hemodynamics in the heart, and then the muscle respond to this disease. And the way the muscle responds to the disease in women will be different than in men. That's something we know. So because this response, and so the heart are going to remodel differently in women and in men, so the presentation is going to be different.
Thank you very much, Dr. Clavel. I think that's really, really interesting and important to understand. And maybe my next question would be, what would be your message to all women regarding heart valve disease, and maybe in terms of early detection and diagnosis? So in short, what do we women need to know?
So the first message would be, if there is cardiovascular disease in the family, any cardiovascular disease, it's not only for valve disease, don't think that is just a man problem. Okay, it occurs in women, and it could be really an issue. If there is an history of valvular heart disease in the family in the young age, for example, a father or a brother that have been operated around 50, 55 for valve disease, that's probably linked to congenital valve disease. And as it is congenital, it's partly genetic, and then you could have it too. So you have to be checked for that. The second thing is that everybody should have a regular stethoscope check. Okay. And a good one. And when I say regular, so the regularity could change if you're younger or older, but after 65 years of age, it's every year. Every year you should have a check with a stethoscope of your heart. And if there is any murmur at any age, even if you're young, it should be investigated. Then women should know the symptoms of the disease. So the classic symptoms of valvular heart disease are limited exercise. So symptoms are at exercise. For example, climbing stairs, shortness of breath, angina, so chest pain, and it could be like lightheaded or syncope. And if you have to know yourself, you know what you're able to do, you know what your daily routine, and if you cannot perform your daily routine because of shortness of breath or you're limited in your daily activity, don't put that on the aging side. I'll say, okay, now I'm 70, so I'm not able to climb a flight of stairs. No, you can work and climb a flight of stairs at 70. That's not an issue at all. So there's probably something else going on.
That's really, really interesting, Dr. Clavel. And as you mentioned, knowing the symptoms that you mentioned, breathlessness, fatigue, and dizziness, and not confusing it with normal symptoms of aging. That's really, really important. And my last question would be, as you know, our community is mainly of patient organizations, of amazing patient organizations doing great work around the globe. What can we as patient organizations do to support early detection, diagnosis, and treatment of heart valve disease in women?
I agree with you that patient organizations do a tremendous job. And I think that the most important thing that could be done is awareness. That what we do today, that it's essential, it's key. If you don't know, you can't be prepared. So people have to know that it happens and what to look for, stethoscope check, symptoms and everything. So provide information on the diseases, what are the symptoms, what are the resources that you can go and a good information, because now in the internet you can find anything, but not everything is could be very good. So trusted information that people could go and look at if they have any question, and they can trust, they can rely on. And I think it's really important. And I think also we have patient organization that helps research, which also is really important too, improving research on the topic to find the new diagnosis, new treatment, and so on. But I agree with you that the patient organization do a really, really, really good job.
Amazing, Dr. Clavel. Thank you so much for really giving us this brilliant talk, for giving this interview about heart valve disease in women and the importance of really listening to our hearts.